In this video, we're going to demonstrate safer injecting. We're using common kitchen ingredients instead of illicit drugs, but we will be showing injecting equipment. This can be triggering for some people, so please be aware. To get started, if you can, clean the surface that you're going to work on. If you don't have access to running water, you can use swabs. Always follow the correct hand washing procedure. If there's no sink, use antibacterial hand gel or wipe your fingers with swabs. Wet your hands with running water, then turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Be sure to soap the backs of your hands, between your fingers and under your nails. You can also wash the skin where you will inject. It's best to wash your hands for about 20 seconds. You can time it by humming the Happy Birthday song twice. Then rinse well under clean running water. If you're in a safe space, next it's a good idea to set up your equipment. There are 3 options for water that you can use. The safest is sterile water from the needle exchange. If you can't get this, use water boiled in a pot for 5 minutes with the lid on to prevent bacteria from the air landing in the water. Or you can use tap water, but use the cold tap and run it for a minute first. Filtering your mix removes impurities and will help you keep your veins as healthy as possible. Depending on your circumstances, there are 3 options you can use: wheel filters, Sterifilts, and sterile cotton wool. The bacterial filter can be used for things like methadone, Suboxone, or amphetamine. And if your drugs have been in your mouth or someone else's mouth, this is also the filter to use. If you are crushing pills to inject, such as oxys, you should use the coarser filter to remove the pill base. Before you start, use the swab to wipe the spoons. And if you're using coated pills, use a swab to remove the coating. Then crush the pill to a fine powder between the spoons. Wheel filters work best if they're primed. You do this by drawing water into one of the barrels, screwing on the filter, then pushing a little water through it. You will want to leave 2 to 3 mils in the barrel to mix with. Once the filter is primed and the barrel is loaded with water, remove the filter and place it carefully to one side. Add the water to the spoon. Gently stir the mix around for a minute or 2. Use the end of the barrel and don't heat the mix. Next, make a cotton filter and drop it in the middle of the mix. Suck your mix through into the barrel through the cotton wool. Attach the wheel filter to the barrel, then add a drawing up needle to the wheel filter. Take a new barrel. Make some room by pulling the plunger back. Then insert the drawing up needle into the front end of this barrel. Slowly push your mix through the wheel filter and into the empty barrel. Safely dispose of the first barrel with the filter and drawing up needle attached. The second barrel now contains your filtered mix. Attach a new sharp needle. The solution is ready to inject. Sterifilts can be used for any drug that dissolves easily in water. Mix your gear as usual, then open your Sterifilt packet like peeling a banana, with the top facing up, touching it as little as possible. Push the Sterifilt over the needle until the needle sits firmly in place. Sometimes you may need to rotate it slightly as you push. This helps to seal the filter in place. You can now use it to draw up from the spoon or straight from the bag. If you have mixed in the bag, it's easier to hold it with the bottom on a flat surface and put the end of your Sterifilt into the corner of the bag to draw up gently to get all your mix. You will have to draw up a little slower than usual. Using this method, you won't accidentally poke a hole in the bag. The Sterifilt won't retain any of your gear, and it filters 5 times better than cotton wool, reducing the risk of abscess and infection. Remove the Sterifilt and the mix is ready to inject. The Sterifilt is no longer sterile and cannot be reused or shared. While Sterifilts and wheels are the most effective filters, if you can't get them, you should filter with cotton wool instead. It's easy to use and readily accessible. First, swab your fingers. Remove a piece of sterile cotton from the bag. Tear off a small piece and gently roll it into a ball. Then place it into your mix. Place the tip of the needle eye down into the cotton filter and draw up through it. If it gets stuck, just push out a tiny bit of liquid and it should fall off. You can then start drawing up again. Using sterile cotton is far safer than using cigarette filters, tampons, or the cotton balls you get from the supermarket or a chemist. None of those items are sterile. You can get free sterile cotton from Peer-Based Harm Reduction WA. Before you inject, you need to clean or swab your injection site. Swabbing is very important as it helps to prevent bacterial infections. If your skin is very dirty, wash with soap and water first, or use swabs. Keep swabbing with clean swabs until the swab looks clean. But be careful not to graze the injection site. Finally, take another swab, swipe once in one direction. Let it dry and you're good to go. Before injecting, we recommend using a tourniquet, especially if you're having trouble finding a vein. There are 2 types of tourniquets. You put them on in different ways, but the way they work is the same. With a tourniquet correctly applied, you should be able to see your veins rise to the surface, and they should feel firm and springy to the touch. Always inject in the direction the blood flows, towards the heart. Insert the needle in the vein with the eye of the needle facing up. Once the needle is in, pull back the plunger slightly to check you're in the vein. You should see blood in the syringe. If not, try again. Once you've found the vein, loosen the tourniquet. It's a good idea to jack back again slightly once the tourniquet is off. This makes sure you're still in the vein. Then you're ready to inject. This tourniquet is the type used in hospitals and blood collection centres. At Peer-Based Harm Reduction WA, we have them in yellow and multicoloured versions, but they are both used in the same way. Hold it out in front of you, flat, unclipped and stretched out. Pump your arm, make a fist and release a few times. Or swing your arm in circles to get more blood into your arm. Plug the clip into the plastic mechanism and put your arm in the loop, then move it to the area you want. It should be at least 5 centimeters closer to your body than the injection site. Pull the free end to tighten the tourniquet. It should feel firm but not cut off circulation. Put on the blue disposable tourniquet by holding it horizontally out in front of you. Take the right-hand end of your tourniquet and bring it all the way around the outside of your left arm. Tuck the end under itself on the inside of your arm, leaving a loop for easy removal. If you can't hit a vein straight away, don't leave the tourniquet on for more than a couple of minutes. You need to release it, pump your fist to get more blood into your arm and start again. Following good hygiene, using filters, and following the other tips in this video will all help injecting drug users protect themselves from infections and other related health issues. If you'd like to know more about safer injecting, contact us at Peer-Based Harm Reduction WA. And if you're worried about your health, why not drop into our free clinic for a non-judgmental, confidential checkup?